Hello, everyone. How are you all doing today?
Good.
Hi.
Good.
Hello.
Great. Thank you. Welcome to the GatherVerse She Summit 2025. I'm Sid Howard, and I will be today's moderator for this roundtable panel on lifelong vitality advocates of women's health. We have a great lineup of panelists today, so why don't we get started? Hello, guest speakers. I will be going down the line and on my screen and have each of you briefly introduce yourselves, what you do, and why have you come to GatherVerse. So let's start with Jackie. Hi.
Hi, hello. I am so grateful to be here. I'm Jackie Roby. I'm the founder of Inspire Journey Consulting. I'm a relationship mindset coach and speaker, and I empower ambitious women of color and allies to break free of hustle culture, reclaim their time freedom, and write their next chapter as the main character of their story.
Oh, wonderful, wonderful. Thank you so much for being here. Uh, Lashada. Lashasta, I'm so sorry. Please correct me if I'm wrong. My little dyslexia.
No worries at all. Grateful morning. You corrected yourself. It's LaShasta. I am a licensed professional counselor and certified sleep science coach, and I literally just teach people how to sleep. So from leaders, especially women, high stakes, learning how to rest and sleep to, and one, have a better quality life and the life they don't think they can have, and then to increase their productivity.
Oh, wonderful. That sounds great. Thank you so much. Miriam, hi. You're muted. You're muted.
I see. Sorry about that. Hello, everyone. I'm so excited to be here. I am a functional medicine dietitian and a breathwork facilitator. And so I support individuals to resolve the root cause of their pain and their illness through a combination of nutrition, advanced diagnostic testing, and also somatic practices like accessing breath. And I'm really excited to be here. I think women's health and these kinds of conversations are just so important to have. So thank you.
Great. Welcome. Happy to have you here. Adrian, hi. You're muted too. Can you unmute yourself? Uh-oh. There we go. Hi.
Okay, sorry about that. Hi,
No
everybody.
worries.
My name is Adrienne Cotton. The name of my company is Adrienne Cotton. And what I do is I help women midlife and beyond grow strong, and have strength and purpose in their lives. What do? I have a contextual model. It is made up of what I call my wellness wheel. It is a wellness wheel. In the center is midlife wellness and vitality and health. My spokes are sleep, stress resilience, strength, food as fuel, walking away from the cultural deprivation dieting mantra, and then calendar, how to make this all work for you and master your calendar. I work with small groups of women, I work with individuals, I work with organizations, and I'm really excited to be here.
Wonderful. Thank you so much, Adrienne. I'm excited to learn more about sleep. I think we all need to learn a little bit more about that, especially where we are right now. Marie, hello. Welcome.
Good morning. Good morning. My name is Marie Zitomo Quintanilla, but you can call me Marie ZQ. It's too long. I am originally from West Africa, but I live in LA now. I'm an author, a professional speaker. I'm also a speaker for American Cancer Society for 13 years and an ambassador for them. I'm a cancer survivor. And I have a company called C Coaching here in LA, and we help individuals and businesses grow through business consulting.
Oh, thank you. Thank you so much, Marie. And thank you so much for being here.
Thank you.
Thank you. Molly, hi.
Hi, everyone. I'm Molly Campbell. I am a keynote speaker about domestic abuse. I am a survivor of a domestic abuse marriage and left 4 years ago. I've turned my lived experience into public speaking. I'm also a 30-year veteran of working in human resources. And I talk about the intersection of domestic abuse and the workplace and how employers can help with my mission to destigmatize domestic abuse, inform their employees about the different kinds of abuse, the resources that are available in the community, and to advocate for their employees. Thank you. Glad to be here.
Thank you. Thank you so much, Molly, for being here, and to all survivors speaking today. We honor you and congratulate you of coming this far. So thank you so much.
Thank you very
Amy.
much.
Yes, Amy.
Hi, my name is Amy. I own Hidden Consumers Consulting. What I do is I work in the natural and organics industry to help create a marketing strategy and implement a plan that actually brings people to their companies that need the services they provide. I'm here because as a woman, I've struggled in the medical world to get diagnoses. My health was directly related to food, and I went undiagnosed for 40 years. So that's a lot about what I do in the natural and organics, is teach them about what's really in our food and why natural and organics is what people are looking for, but they can't find them. So
Thank you so much for being here, Amy. Elle, or Ellie.
Hi. Yes, it's Elle. I get Ellie all the time too.
Okay.
I'm Elle. I am a happiness expert, an author, and now researcher, doing my own research now for positive psychology, really passionate about infant mental health. Yes, it's a thing, and mental health with women. So thrilled to be on this panel today.
Great. Thank you, Elle. Thank you, everyone, for being here today. I'm excited to learn from all of you as we get started, learning from your experiences and expertise, as you've accomplished a great deal. And we will get started with our first question of the day. Is what are the most pressing health challenges women face, and how can we better address them across all stages of life? Let us sit with that just for a moment, collect our thoughts, and I will call on the first speaker to speak. Let's go with LaShasta. Unmute yourself, please. Sorry.
Have to remember that. I would absolutely say sleep. That is the most pressing, because it's also the foundation of 7 of the 15 chronic diseases are tied to sleep deprivation. Women in the U.S., health disease is the #1, and it's tied to lack of sleep. And we are in this whole hustle grind culture that tells us we have to work, work, work. We have to do all the things, especially as women. And sleep is gone. Like, a lot of women are saying, oh, I'm fine on 5 hours, I'm fine on 4 hours. And they're absolutely not. And until they're willing to embrace the fact that they have to go to bed, then all of the challenges will continue to be pressing no matter what they are until they go to sleep. But once again, no one's death report says sleep deprivation.
Wow. That is really important to understand that. Thank you so much, LaShasta, for explaining that. Sleep is definitely something very important, and I know myself, I'm very guilty of losing the sleep. It looks like Adrienne, did you want to chime in? Yes.
I'd love to tag team with the Shasta. I'm glad you're here. I'm sure it's really hard being out there. I'm a Californian. I'm kind of choked up about it, from Southern California. Watching all you're going through right now it has to be really hard. So thanks for being here. I'm going to tag team because of my wellness wheel, because I believe that our health challenges are a confluence of a few strategies, that women are stuck in a mindset. And we are stuck partly in a mindset of productivity. More is better, and less sleep goes with that. We're stuck in a mindset, well, let's talk about food, about deprivation dieting. Less is better. And so I believe it's all 5 of my wheel. I really do. It is the biggest challenge we have. We're not eating enough. We're not sleeping enough. We're not strength training enough, because we are caught up, particularly midlife women. Midlife women are still stuck in their 20s and 30s mentality that you have to have high intensity cardio. You have to have a pool of sweat on the floor underneath you. And frankly, that's exactly the opposite of what we need in midlife. I think that we also need to figure out a way to hone in on our stress. Stress resilience is part of my practice, and it goes hand in hand with LaShasta's expertise in sleep. They go together. When your stress resilience practices, you have your good tool set, then your sleep is better, and the opposite applies. And when we don't make time for any of these things, I'm saying 2 to 5 to 7 minutes per day on all 5 of my spokes, then that's what happens with our health. And that's where we see a lot of the challenges with our health system right now. I really believe it's all 5 of them.
Wow, thank you. Thank you, Adrienne. Miriam, you want to jump in?
Absolutely. I think that this is such a critical conversation, especially around stress and sleep with women's health. And as a functional medicine dietitian, I'm always looking at what's the root cause, like why are women experiencing illness and imbalance? And when we look at the leading causes of health issues globally, and especially in the US, of women's mortality, we suffer disproportionately from cardiovascular disease, which is often honestly associated more with men. Like collectively, that's what we think about, but so many women suffer from cardiovascular disease, autoimmune conditions, mental health issues. And when we really look at what are the root causes of this, I think that this extreme like stress and pressure that women do hold, right? We have, we absorb more caregiving responsibilities and stress for our families, whether that's infant care or elder care. And now, you know, with this tremendous amount of stress in like the workforce. And so I think that it comes down to educating women about our bodies. I think that that's another really important piece of this conversation. I know that I have gone through extensive medical training, and learning about my menstrual cycle and learning about my bodies was never anything that I learned about in school. And it was really beyond that I had to really educate myself. So I think educating women about their needs as they change throughout their lives, like what are the pressing needs as they get older with weight training and, you know, resistance training and building bone density and cardiovascular health, and how to eat to really nourish themselves. I think all of these pieces are really important in the conversation of supporting women, women's health and longevity, not in just preventing these diseases, but also helping them feel really vibrant and present in their lives.
Thank you so much, Miriam, for sharing that. And I think those are really important points that we have to recognize, especially the education about ourselves. I really do believe that we are so much in the dark, and especially when we're discussing about caregiving and stress management. As a millennial in what's called the sandwich generation, you know, my generation is taking care of kids, but also taking care of their parents. So how can we cope and stress with that? And I like what our speakers have said so far about stress management and resilience. And speaking of resilience, as someone who is very familiar with positive psychology myself, I want to call on Elle to speak a little bit about more to that, if you have anything to add from the positive psychology perspective.
Absolutely. I think one of the most pressing issues, in addition to sleep, is that the mind and body connection. When we talk about mental health and mental resilience, it's about doing the thoughts, actions, and behaviors that set us up for when we have those traumatic events. So focusing on a gratitude mindset and journaling and these easy interventions that are unknown to so many, that are groundbreaking research that's showing what a gratitude practice can do, and setting ourselves up to combat the stress that we have. But this stress gets in our body, creates autoimmune diseases and other sort of issues that we need to talk about. I think it's a complete, crisis in what we have. And in addition to isolation, what phones are doing to us and our relationships and our mental health is quite scary for me.
Absolutely, absolutely. Thank you so much for sharing that, Elle. Miriam, you have your hand up as well. Oh, you didn't want to. Okay, that is fine, but thank you. Oh, Shasta, go ahead.
I was just going to say that I agree with Adrian. She dropped some in the chat, and I often say this as a speaker when I poll the room about sleep deprivation, when I poll the room about the chronic diseases, and I ask them, how many of you, your doctors prescribe sleep? And literally there's one or two people that may raise their hand. And so I agree with what everyone is saying about the awareness. But as women, we have to first be willing to boost our emotional intelligence. Like, we have to want to be more self-aware, because our body tells us what it needs. Our mind tells us what it needs, but we will dismiss it. We will ignore it. We will say it can wait until later. So we can put out all the resources and all the information, but until each woman is ready to have autonomy of their mental wellness, of their physical health, then it's just information. I mean, we have AI. You can literally use a voice memo. You don't have to type and say, hey, I'm not sleeping. What are some things that I can do to go to bed? And the information is there. So we have more information readily available and easily accessible than I think any time ever. But as women, we're going to have to choose to put ourselves on our list first instead of not finding ourselves on our list at all.
Wow. Yes, Adrian, go ahead.
I just wanted to briefly say what I said in the chat was that women tend to rely on that annual visit with their OBGYN for everything. And we have to just give them, let's just say they don't know everything. They weren't taught in medical school about sleep. They most certainly, in my world, in strength conditioning and in exercise and in food, they weren't taught. They had 5 hours total of both in their entire medical school career. They received 5 hours of education on exercise and diet. So we need to do our own work and then not rely solely on that one appointment per year.
Oh my goodness. Yes, Miriam.
I also think it comes to the medical system. I think it really is important for the patient autonomy and advocacy. I think we are our own best advocates, and we need to communicate with our providers what's going on. But I think the way that our medical system and our doctors and our providers are trained are not to get at those root causes, or not to look at nutrition or sleep or exercise. And it's unfortunate, but my experience has been providers are really uninterested. Like, I've had a patient with endometriosis who ended up in the ER, and her only options were surgery or a medication that was going to put her into an early menopause, and with all of these side effects. And that's when she came to me and we reversed these issues. Her doctor wasn't interested in hearing how she did it. And we were able to do it without surgery, without medication. And so I think that there's a re-education and a re-conversation that's needed in terms of providers and healthcare, because when that happens, a lot less patients are going to get gaslit as well. Because I've been personally gaslit by countless providers. I am also a breast cancer survivor, and I was told that I didn't have breast cancer when I found my own breast cancer. And so I think there's a real need for these conversations and normalizing these conversations with providers, even if they don't have the answers, knowing that there are people that do and that they can refer out.
Oh, thank you so much, Miriam. Before we go on to the next question, I want to call on Molly. I want to call on Molly as she placed something in the chat. Would you like to briefly mention?
Well, sure. It's what other on the panel are saying the same thing, that doctors are not asking about nutrition when assessing our symptoms. So others have mentioned that as well.
Yes, absolutely. Thank you so much. Marie, please jump in.
Yeah, I really agree with everything that everybody's saying right now. One of the things as an ambassador for American Cancer Society is that we promote right now, as we all know, 60% of women are not getting screened for cancer. And the rates are so high. Not only that, but it's so important, even when you don't have cancer, we promote the fact that even drinking a glass of wine every day can affect, or especially when you're stressed and you're drinking and we do have to give each other praise. The fact that we carry so much, we're running businesses, we're taking the kids to school, we're taking care of the home, we do so much. So naturally, of course, we're going to be a little stressed, right? But when we add like the bad diet and drinking whenever we can, in my case, wine, all those things, and not exercising, all those things really end up it puts us in a bad situation. So with that being said, I truly agree with everything that everybody is saying here. And I guess as women everywhere, we just have to put self-care first, because when we truly take care of ourselves, not only that we have less stress, but we also, we don't have to go through going through diseases and all these things. So I truly agree with everybody on here.
Yes, absolutely. I concur as well. Thank you all so very much, which really brings to the point, as some of you, or a lot of you mentioned, about our healthcare system, which poses quite a bit of challenge as well. As this question states, like, how can healthcare system meet the specific health needs of women, particularly in underserved areas? As we were talking about it in a generalized area, but in underserved areas of marginalized communities, how can the healthcare systems meet those specific needs? So I will call on, LaShasta, did you have your hand up? Oh, that is fine. Amy, how about you?
I think this requires, this goes back to the conversation we were just having, but the main factor is doctors don't care. They're not asking, if you come in with an issue, they're just going to be like, well, you're just tired. They're just going to push you off the side. It took me 4 years to get a diagnosis for complex regional pain syndrome because the doctors didn't want to listen to me. They were ignoring what I had to say. In the underserved areas, the research is even more like can you even get into a clinic? Can you even find a doctor that's not only you can get to, are they going to listen to you? And at the end of the day, we have a healthcare system that's really set up to ignore women and their needs. And I think that's the bottom line.
Yes, absolutely, absolutely. Elle, then LaShasta, then Adrian.
The system is broken and it's set up and it's harmful to women. I mean, do we have the rights? And even doctors who want to help, the system and policies they're in, even I think of access to legal abortions for safe access for women and freedom of choice. But doctors are put in this wheel that they no longer have control of what they're able to do with their time. So I think of underserved women. How do they have access to the provider? How do they have access to the information? Here in my community, I can't find an OBGYN. There is no provider that is taking new clients. And so if you can't get access and insurance and the cost and the relationships, and how do women, especially underserved communities, advocate for themselves when it's just so easy for doctors to write a prescription without, as Miriam's work, I've worked with someone similar to you who changed my life when 3 doctors gave me an antidepressant when I said, I'm fatigued, I'm not sleeping. There's a difference between fatigue and depression, and those mental health components are really important, but they're not listened to. So I'm preaching to the choir over here as we're very aligned with this, but I think what we have to do is engage with our nonprofit organizations. We need to advocate, we need to vote and put people in positions of power who have women's best interests at heart.
Thank you so much for that. Jackie will be next after LaShasta and Adrian. Please jump in, LaShasta.
Yeah, so honestly, I think that the healthcare systems are not coming to save us. Recently, Lovey Ajayi Jones said that community is a verb. And I believe that wholeheartedly. So until we work as a community, and coming from a life where I lived as in an underserved area, growing up in poverty and understanding now the difference of the care that we were given as children and in our teens, and even now, being able to advocate and know the questions to ask is the difference. And I believe that we have to share that amongst ourselves, because yes, the system is broken. It's going to be broken for probably the rest of our lifetime and part of our kids' lifetime. But as a mom who decided to be a mom again at 42, I had different questions than from 24. And the way I had different questions was about being in community and having conversations to know. There was no doctor that taught me to go into the doctor's office and say, what is the homeopathic method for that? Because you went to school and they taught you more than one way to solve that problem. And until you know to ask the question, they're not going to access that information. Or to know that as a Black woman, I'm going to be treated differently. My pain level and my pain tolerance is not going to be honored the way it will my counterpart. So at 42, I was smart enough to say, let me put people around me that either look like me or are allies to me. So when I'm in pain and I cannot advocate for myself, they can. And I can tell you, it saved my life, because when after my pregnancy was fine, everything was great, but the day after I went home, within 24 hours, I was back in the hospital. But with postpartum preeclampsia, which no one really talks about or know about. But the reason why I is because my doula looked like me, my OBYN looked like me, which she was the only one in the Austin area, and that was accepting new clients, to your point, Elle. And then the one that was on call, same thing. And she took an hour and a half looking at one number in my blood results. And she told me, had I not started to research on my own, because they didn't teach her this, I would have let you go home and you probably would have come back and been admitted into the ICU. It's important to have community, to have the conversations, and then to know how to show up in that space and advocate for yourself, because the system is not going to save us, and it's not going to be fixed anytime soon.
Thank you so much, LaShasta. I resonate so much with what you said for that. I'm going to also go to Adrian as well. I know that a lot of us have a lot to say on this, so I'm going to keep this going, keep this conversation going, because I believe that this is really important. Adrian, go ahead.
Yes, women were not required to be in medical studies until 2016, women-only studies. So our healthcare system, we're all repeating each other. We all should be in a group hug right now. We are all agreeing. The system is set up for men, and the machines. All the diagnostic equipment is set up for men. So it has to start at the medical school. I really and truly believe this. I think at the medical school is where it needs to start, and I don't know how that happens. I am not an expert in how the medical schools change. It has to do with their donor. You all may be much smarter than me on that. And I do believe, because I work with midlife women, and LaShasta, you were talking about you wanted to be with someone who looked like you, who was around your age. Black women suffer more from perimenopause and menopause than I do. And we know this, but how many doctors know that? And so when it comes to working with women in perimenopause and menopause, I really challenge my clients and the companies that I work with to help women find somebody different who actually knows what they're talking about and has maybe even experienced like we have. And I do think in the underserved communities, look at how many women are going through perimenopause and menopause, and they don't even know what it is. A lot of times they're going to be given an antidepressant and sent home because they're stressed. Well, yes, they're stressed because their estrogen or their progesterone is on a roller coaster ride. And I just think, bottom line is, I think it has to start with the schools. I would love to teach about menopause in grade school, because they're teaching them about, they're teaching them the birds and the bees, but they're not teaching them about what happens next.
Yes.
There's not a lot of research on that. So.
Oh my goodness, absolutely. I'm seeing a lot of hands go up. I'm going to call on. I love it. And even Amy said in the chat, we do not have healthcare, we have sick care. And we do need to find ways to reimagine what our healthcare system looks like. Jackie, what are your thoughts?
Well, I wanted to say that LaShasta said a couple of things that really hit my heart. Number one, community is a verb. And second, the healthcare system is not coming to save us. And what I thought about when you asked this question is, it's frustrating because I don't have an answer. I don't have an answer to the fix because I'm not sure how we do it. And that makes us feel really hopeless. And that puts us in this space of victimhood, and we don't deserve to be in that. So what are ways that we can empower each other in the meantime? I also have a story of not being heard. Adrian mentioned the healthcare system being set up for men. I want to be really specific. It's set up for cis, white, hetero men. That's who it's set up for. And when we think about people who are underserved, I'm a Latina, I'm technically in that category. And when I went to a doctor 17 years ago with such ridiculous panic, paranoia, depression, CPTSD, I was told by a white woman to take vitamins, even though my psychologist said, you need medication. It got to a point where I wasn't put on medication until I was in a hospital because my panic had me in such a way that I passed out in the shower and hit my head. This is uncalled for. We're not being listened to. So how can we create spaces that are safe and create funding outside of the healthcare system? Because those 2 minutes at a time, I'm generalizing, I don't know the number, but the 2 minutes of care you get are not going to cut it. But it is professionals like the women in this room who are going to take the time to help. So how to create that? And as a business owner, we can look at things like sliding scales, or we can look at scholarship opportunities where we have clients who have the funds to be able to pay and pay maybe a higher amount so that the next person can get the help they need no matter what.
Yes, absolutely. Oh my goodness, thank you so much. We have a lot. Miriam, we're going to have to move on to the next question, as it is very much connected to what we are discussing. So definitely Miriam, and then Marie, and then on to the next question. Go ahead.
Yeah, I think this conversation is so powerful, especially when it comes to serving underserved areas. Unfortunately, I think in the US, healthcare is a privilege. It's not a right. And when we look at the leading causes of bankruptcy in the US, 60-something% of that is actually because of medical debt. And when it comes to accessing like good care is expensive, you know, and I can pick up my prescriptions at my pharmacy for free, but supplements that actually help to get at like the root cause of those nutritional imbalances, that is so pricey. And so I really have to echo what Jackie was saying about this need for scholarships, about this need for a sliding scale, and then also community support and community education and sharing like how to eat, right? There are a lot of individualized ways that we can customize, you know, our diets and how to nourish ourselves and getting really at those root causes. But also at the same time, there are ways that we all universally can think about food and nourishing ourselves that we can hold in community settings. And so I think conversations like this are really where it starts to begin shifting that, because the system, the insurance system, is really such a frustrating thing for so many people to navigate. Plus that barrier that we've been talking about you know, doctors and how they're valuing like holistic care. So I thank you so much. This is really important.
Thank you. Marie, go ahead. Thank you so much.
Yeah. Yes. And, you know, I wanted to say something about what Jackie just said, because last year in January, I went to the summit that we had for American Cancer Society, and the numbers for African Americans, Blacks, and Hispanics was so low because we're not getting screened for cancer, and the studies are not being done for Black women and Latinas. So I truly agree that we need to do better. The underserved areas, I think we should have clinics available for them to get screened for cancer or for any diseases or for any health issues. They're not being screened early because they don't have the insurance or they don't have the resources. So, or they just, it's not being promoted. If you look at media, when they promote health, there's Caucasians, you don't see Blacks, you don't see Latinas. So it's not really being enforced in the lower community, and we just need to do better. We need to have resources, we need to have education, just awareness that we need to do better.
Yeah, I concur with that as well. And as we're talking about our healthcare systems, as we're heading towards our end, unfortunately, this is great conversation. But as we are talking in the midst of a tech panel, we are wondering, let's see if the slide can talk. Okay. How can technology and innovation help to improve all women's access to health services? We talked about the systems piece as a whole. How can we bring technology to help support us in this? Okay. Elle and then Amy.
On one side of the coin, the technology is incredible. If we can diagnose earlier breast cancer and other sort of interventions for earlier diagnosis and better testing, more virtual options for accessibility and reduction of cost, technology can transform healthcare for women. But yet also technology can hurt because there's false information out there where we're obtaining the information from our tech. And I will again say the technology has been directly correlated with the mental health issues of women and our next generation. I have an 8-year-old girl, and technology and social media is harming our young women. And we need, as a community, to stand up and say, we're not going to allow these companies to financially benefit from the reduction of mental health of our youth. And so, I'm like, I see a lot of nods, like pulling on strings here. So I'll let you go with that.
Thank you so much. And Amy, please do jump in.
I'm going to say just really quickly, I think the flip side of technology is it's where I find my communities of people. I got diagnosed with a rare allergy. I go to my community. We understand each other. We have advice. We're like, or we just sympathize with each other because we're like, yeah, that just sucks. But it's our communities. But again, it's a privilege to have the technology available. Not everybody has that access. So how do we take technology and make it available to everyone so everyone has that ability to grow and find the support they need?
Yes, absolutely. Where do we find that balance? How can we find that balance? Absolutely. LaShasta, please.
So I hear what Elle says, and as a licensed professional counselor, I've seen it firsthand. But to Amy's point, there is more good that can come of technology than not, because when we talk about kids and technology, that's a parental problem. Like that's a parent space of how you allow your child to have access to it, and when they go to school, what that looks like, etc. But big picture, I use an app to monitor my sleep called Sleep Cycle. Did it for years, even before I knew that the sleep strategist was going to bloom in me. You know, I use it. I have an app that I do my devotion and my breathing with that helps with my mental health. I have another app that allows for learning mindfulness and practicing mindfulness. So in all of these are free versions, except my sleep one, I upgraded, but they're all free versions. And most people have a smartphone these days that can download apps. So that's how we use the technology and innovation on an individual level and a community level, as well as AI. Like, absolutely, you can go there and get information. I like to use Gemini because it pulls from all of Google. And Google is a solid search engine. And no, you can't believe everything that you Google with your symptoms, but you can ask it, what questions should I ask my provider when I have these symptoms? So once again, the technology can be great and beneficial depending on what we put into it. Now, if you say I have all of these symptoms, what's my diagnosis? That's different, right? Versus what do I ask the medical professional when I go in to speak with them? So I think utilizing the apps is a great way to go, and finding your community online as well. Amy, I 110% agree with that.
Thank you. So, Molly, please.
Yes, I've been silent for a little while, just listening, because my area of expertise is in domestic violence and domestic abuse. And one of the things that I see happening with the healthcare is the stigma of being a victim of domestic violence or domestic abuse. How can technology help that? I see that there are a lot of communities that can help women, because that's the majority of the people that are victims. Like Elle said, having communities where they can share their experience or be part of a group. But the healthcare system is not, just like not asking about nutrition or sleep. They're not schooled or educated to ask about what's going on in the home, what's going on with your intimate partner, because it's hidden. there's a stigma. There's still a stigma about talking about it. So I want to use technology to help eradicate that stigma and bring domestic abuse out of the shadows.
Thank you. Thank you so much for sharing that, Molly. Unfortunately, we're at time, so I will call on Jackie for her last words and ask the question overall, how do we overcome the stigma that we face in this healthcare system?
Ooh,
Jackie.
okay. That's a big question. First and foremost, women experience psychological patriarchy. So simply by what we experience from the patriarchy makes us twice as likely to experience depression and anxiety. I chair the Global Wellness Institute's Diversity, Equity, Inclusion Initiative, and part of our research is video interviews. And we ask, if you were to prioritize mental wellness, physical wellness, or financial wellness, if you had to just choose one, what would it be? And 83% of the participants said mental wellness, and 98% of the participants are women at this point. Yet we put it on the back burner. And we won't be able to make any of these choices to support our health unless we recognize that we need to be a priority. That time is not the problem. That we have been molded and conditioned to believe that we come last. So how do we put ourselves first? And that's the kind of empowerment that we need.
Oh my goodness, Jackie, thank you so much. What powerful words. And what a powerful panel that we have here today. We have such passion and such advocacy surrounding this topic on how can we overcome these challenges of our health, women's health especially. So if there are any last words, final words. Yes, Marie. Unmute yourself.
Yeah, what I would say is, as women, together we are so strong. Together we can do so much. So let's get together as women and make a movement toward uplifting each other, supporting each other in every area, in the business world, in health, in every area, especially in health, where maybe reaching out, reminding a friend, have you gotten screened this year? Did you do your yearly check-in? So together we're much more stronger. Thank you.
Thank you all. Thank you all so very much. And yes, I agree with Jackie. Let us use technology to use our voices as we are doing here today and minimize this and to erase that stigma. Thank you all so very much for being here today. I am so grateful to be on this panel, to be moderating this panel. This gives me so much hope, and I have so much gratitude. So now we are at time. Thank you all so much for joining us. And please, for those of you who are watching, connect with these wonderful and powerful women and their social media handles, or however you feel comfortable connecting. And once again, let us all continue the conversation moving forward as this concludes our roundtable panel discussion. May our gather be well, and until next time, back to you, GatherVerse production team.
Thank you, ladies.